In part two, we're spending more time in trying to put ourselves in the shoes of the person with dementia and in identifying potential triggers to situational changes in behaviour. So as a quick recap to the first part, we've said that some changes in behaviour are constant and the result of changes in the brain, but others come and go and are much more likely to be situational based on how the person is feeling and needs that they have that are potentially unmet. So in the next slides, we're going to look at some tips for working out what might be going on and what might help, and we'll have 3 practice scenarios to work through. So if I'm trying to put myself in another person's shoes and work out what they're thinking and what they're feeling and what they might need in order to prevent this perhaps more undesirable behaviour arising, what I need to be doing is trying to identify triggers, things that happen just before the behaviour happens, and maybe patterns. So is the behaviour always happening at this particular time in this particular situation? So the kind of things I need to be thinking about are the person's psychological needs, and we'll look at those in the next slide. What I know about the person that might give me clues as to what's going on. Is there anything going on in the environment or within the person, any physical factors that could be adding to that situation? And actually, could I be doing anything to add to the situation? Are my expectations of what the person can and can't do realistic now? This flower diagram was produced by someone called Professor Tom Kitwood as a way of explaining what actually all our psychological needs are in order that we should be happy. So it's a case of thinking of, is the person's dementia making it more difficult to meet their needs? Because each petal of this flower represents a need that we all have. So for instance, a need to keep up a social network and maintain clubs and hobbies. Is the dementia impacting on that? A need to feel close and connected to family and friends. A need to generally feel comfortable and at ease in a home environment. This one's a big one, a need to feel worthwhile and valued. One of the big things that people say is that they don't feel that they're being useful anymore to anyone else. And a need to be able to organise their life and have things to do and a sense of purpose, something to get up for in the morning. So in terms of psychological needs, we need to be thinking, how much is the person's dementia impacting on their ability to fulfill all the things within this flower diagram? And if there are gaps, is there anything that I can do to help compensate for that loss? And then the next thing is about the fact that somebody that knows the person well is really the best place to come up with clues that might be triggering some of the behaviours. So you will know what kind of things are important to them, how they see themselves, what's happened in their past that might have shaped them into the person that they are now with the reactions that they're having now. How has the dementia impacted on them? Were they, for instance, previously very much a person who was in control and in charge, or actually have they always been okay to take instruction and direction? You know, how is the individual? How is it affecting the individual? And then you'll probably know too whether they have any other health difficulties or illnesses, or whether perhaps they've had a mental health history in the past. And just even things like their eyesight. Do they need their glasses? Are they going to be hearing me correctly? What do they need? So the next point to think about is, are there any factors going on in the environment or physically for the person that could be adding to the situation? So the kind of things to think about are, in the immediate moment, is it too noisy? Is there just too much going on? It's often harder for people with dementia to focus their attention, so that can be a negative factor for them. Is the particular situation meaning that they're being rushed? People often need a little bit more time to do things, so if they have a sense that they're under pressure, that can be an aggravating factor. Or, you know, how are they physically? Are they under the weather? Do you know that at they're particularly tired at this time? Might they be in pain and just not able to tell you? Might they be too hot, too cold, hungry, thirsty, all of those sorts of things. And then in terms of recognizing patterns, because that can be a big clue, the kind of things to think about is the behavior that you're noticing at a particular time of day, which might indicate, for instance, that the person is getting tired at that time, and that maybe certain activities that require more concentration focus should be at a different time of day. Is the behavior with a particular person? And so what is it about that person? Is it that perhaps they remind the person of someone from their past? Or is it that the communication style of that particular person is in some way not ideal? There may be, and we'll talk more about that in the communication session. Is it in a particular place? And is there some association with that place, or something generally that makes the person uncomfortable, or in response to a particular activity? So those are all things that could give you clues in terms of patterns of behaviour and what might be triggering it. This next one is a difficult thing to consider, but it is an important point. Might I actually be doing something to add to the situation? It's incredibly difficult to accept that the person you love might be changing, maybe in terms of their ability to fulfill a role, so the loving spouse, the dependable parent, the loyal friend, etc., and maybe becoming increasingly dependent on you. And that there are changes in the level of intimacy that you can share. And remember, there are many different forms of intimacy. It's not just about physical intimacy, but what about that emotional bond? The intellectual intimacy, the ability to have conversations and spark off one another new ideas. Spiritual intimacy, or just the person that you enjoy socializing with and having fun with, the recreational intimacy. So just as some people, when they're diagnosed with dementia, find it difficult to accept it, they minimize their problems, they deny perhaps their diagnosis, and that's, a way of protecting themselves against having to acknowledge what's going on. So too, it's not uncommon for spouses, sons, daughters to expect too much of the person they're caring for because they really don't want to accept and come to terms with anything different. So really important here to access all the support you can get through family, through friends, through carer groups, and even sometimes through counselling to try and come to terms with this. So in the next few slides, we're going to look at 3 different scenarios to try and start looking at changes in behaviour and what might underpin them. So in the first scenario, we have Sudesh. Sudesh was a bank manager, and very important to him was that he liked to look smart. But one day, when his wife was out shopping, she came back to find that he had cut a hole in the sleeve of his jacket. And the clue that she had was that there was a discarded sandwich on the table. So maybe you've already got some ideas about what's going on, but let's unpick it on the next slide. So assuming it was the case that the sandwich had somehow leaked onto the sleeve of Sudesh's jacket and stained it, then trying to break it down, it may well be that he was thinking, oh no, I look a mess, I need to get rid of this stain, because that conflicted with his need to look smart. And maybe accompanying that, he had a sense of embarrassment, anxiety about the fact that he looked a mess, maybe even shame. He was trying to solve this problem, but his problem-solving skills were impaired. He wasn't able to see the consequences of the solution that he came up with, that of cutting the stain out of his jacket. But ultimately, he was trying to be true to his need to look smart and presentable, which was how he'd always been. Now, obviously, that doesn't change the fact that he's wrecked his jacket, but what it might change is his wife's reaction when she comes across the situation. So rather than thinking, what's happening now, he's becoming dangerous and unpredictable and cutting his clothes because of his dementia, if she can understand, oh look, yes, there's that sandwich there, I bet I know what happened. He stained his jacket and he was trying to do his best to sort it out. His best has caused the wreck of his jacket, but I know he was trying to do his best. I do understand. And that is likely to have changed her reaction to him. So in the next scenario, our couple is Mark and Susan, and the story centres around Mark's garden. Now, Susan had in fact been on one of our Understanding Dementia courses and had described this situation and new behaviour to the group. Mark had always been very keen on his garden, had kept it pristine. It's been very much his domain. She'd never really got involved. But in recent weeks, there had been brown stains coming, dead patches on Mark's beautiful lawn. And Susan had worked out that he'd been muddling up the lawn feed and the weed killer. So she tried to intervene in order to prevent that muddle. And Mark's reaction had been to become angry and actually even to raise his fist to her at her intervention. So Susan was distressed. She was wondering whether her husband was becoming violent as a result of the dementia. And this is what we talked through with her on the course, and we're going to break down on the next slide. So by his reaction, it was clear that Mark was feeling that Susan was interfering, and his feelings around that were anger and confusion. This was a new situation, one that he didn't like, didn't understand, and his reaction, because he was finding it harder to explain what he was thinking and how he was feeling, was to give a non-verbal indication of where he was, and that was he put his fists up to Susan. And that Mark's need from this scenario was obviously to be in control, capable and independent, and to have a sense that he was knowing what he was doing. So we talked in the group about how Mark's need could be met so that he didn't need to feel this anger and confusion and this sense that his domain was being interfered with. And people came up with different ideas. One person suggested removing the weed killer altogether, but Susan rightly pointed out that he would notice that and it would still feel like an interference. And then someone else came up with the idea of emptying out the weed killer and filling it with some other more innocuous solution, possibly even lawn feed. And that was actually the solution that we decided would be most likely to meet Mark's need, and a sense that he could carry on working in his garden without interference. And he'd no longer have these confusing brown patches appearing on his lawn. Obviously, he might have some very healthy weeds that perhaps would need to be dealt with in a different way, but that seemed to be a solution. So it wasn't that overall Mark was becoming violent, but it was that this particular individual, Mark, had a great need to feel independent and in control, and somehow or other Susan needed to be trying to find a way to help him to achieve that. And in this third scenario we have Joyce. Now Joyce was an elderly lady who lived in a bungalow in Wokingham. She lived independently. She had all sorts of physical health problems too, and she had dementia, but she was managing with the support of the local GP surgery, the district nurse, and family around. Until that was the day that she answered a knock on the door, and two young men barged their way in, terrified her obviously, and stole from her. And from that day on, Joyce no longer went to bed. She sat on guard in her chair. Also, she wouldn't answer the door, so the district nurse was having trouble getting into her and helping her with her physical needs. And all of that ultimately led to the fact that she was sectioned under the Mental Health Act and admitted to Prospect Park Hospital for her own safety and well-being. And ultimately her family took the decision from there to move her into a local care home where they were hoping that she would feel safe. But one very early behaviour that the care home staff were having to deal with was the fact that Joyce was dragging furniture against the door of her room, and they were having difficulty getting into her. So in the next slide we will think about breaking down that scenario and seeing whether there's anything that we can, any action that we could take that could alter this new behaviour, this barricading herself into her room that is a difficult one to manage. So this is a relatively straightforward one to break down in a way, in that what Joyce is obviously thinking is that in some way she's going to be attacked and hurt when she's asleep, and she's frightened and anxious, and so her action is to try to protect herself, and her need is to feel safe, to feel that people won't be able to come into her room. So what could the care home do to meet that need? And they actually did respond very appropriately. When I've used this scenario in some training situations, I've had the suggestion that perhaps the care home staff could screw down the furniture. But of course that displays a lack of insight to what's going on for Joyce and what she actually needs. What the care home actually did was they purchased a large lock, which in fact could be opened from the outside as well, but Joyce wasn't aware of that. They installed the lock. They knocked when they needed to come in. She was able to get up and get to the door and open the door. And when they were leaving the room, they would encourage Joyce to lock the door. They would rattle it. They would say to her, "That's it. It's locked now. You're safe. No one can get in." And they would, and Joyce would then feel more secure, and that did actually stop the difficult behaviour of the barricading herself into the room, because clearly it was meeting her need. This lock was meeting her need to feel safe. So it can be really helpful if you can just get your head around what are the thoughts, what are the feelings, what is the need, because that can really give clues as to ways that the behaviour could be prevented if the needs could be met. The Alzheimer's Society produce a whole range of fact sheets, but these are some that you might want to have a look at that relate particularly to changes in behaviour. Now we'll take our next break. Maybe some of you have some examples of changes in behaviour that perhaps we could work at in our discussion to see if we can do a similar thing, work out what the thoughts were, what the feelings were underpinning the behaviour, and whether there would be any way that we could make changes in that situation.